Good afternoon, everyone. Welcome to the afternoon session of our national conference. The next speaker for the day is Dr. Velkumari, Head of the Department and Professor of Physiology, JIPMER, Pondicherry. Dr. Velkumari is also the administrative in charge of ACYTER, the Advanced Center for Yoga Therapy, Education and Research at JIPMER. With over 27 indexed publications, Dr. Velkumari has been awarded with the prestigious Dr. Attatran Nanda Memorial Award from the Association of Physiologists of India in the year 2015. I welcome Dr. Velkumari to deliver her lecture.
Can you switch on PowerPoint? I've loaded already. Open in this mode, full screen mode. Either use either better. Okay. Okay. Because I'll not be seeing there. Okay, I'll see here and see.
Okay. Whatever is comfortable
Yeah.
for you.
Very good afternoon to you all. Another 20 to 30 minutes. I'll be talking about the yoga for women health, a brief introduction about how yoga is valuable for women health. Adopting yoga makes her life, makes a better quality of life. What are the unique problems she'll come across during the all walks of her life? And after that, we will give a practice session to show how simple yoga is a simple thing which we can adopt. And if we adapt, what are the benefits we achieve? Why this time I've specifically taken about yoga for women well-being, although it doesn't mean that yoga will help only women. It gives immense benefit for whoever who practice from any age group. But only thing is this time, the theme of International Yoga Day is women empowerment. Hence, we have taken the specific topic on yoga for women well-being. Why is yoga important for women well-being? As I mentioned, no. Okay. Slide changer. Okay, fine. So a yoga practice offer multifaceted benefits for women tailored to their specific life changes. And if you see biologically, the life stage of a woman is divided into infancy, puberty, that is adolescent, reproductive age, which indicates the sexual maturation, climacteric period, that is 5 years before and after menopause, and post-climacteric period, the elderly women, and in addition to specialized situations like pregnancy and lactation. These are all included as life events unique to women. And in this entire life of woman, she faces several health issues and in various stages of life. And evidence-based medicine, evidence-based research claims that yoga is a complementary therapy to human health and well-being. Just it is a the slide looks little exhaustive, but just wanted to show you that, see in the x-axis, what is given is the age group, age of the woman starting from 10 to 70 years. And in the y-axis, if you see the hormones hormonal secretion, the female, the hormones, no, that mainly influence her life. That causes if there is an imbalance or out of balance, then it causes multiple disorders. So basically, that's why I'm focusing on only the hormonal. Of course, many other factors will influence, but key factor being the hormonal influence during the reproductive age group. So, and if you see, from the age of menarche, you see, from the age of menarche to school going, and from the childbearing and menopause, the hormone, if you see that this blue line, blue graph, what you're seeing is the hormone levels. It starts racing and it is optimal in the reproductive age group between the adolescent and the after from 15 to 49 or 55. Menopause sets in India around 51 years, 50 years. So in this, and then it starts declining. In that time, if there is an optimal balance of this hormone, then there is no difficulties in life. If there is out of balance or if there is imbalance, then it leads to many disease. And during this phase of life, the women undergo lot of problems, non-communicable diseases, the eating disorders, anxiety disorders, sexual harassment, sexual violences, somatoform disorders. That means somatoform disorders are disorders something like which has a psychological background with physical manifestations. And during this period, she has to face several challenges: work-life balance, care for elderly. Then there is one syndrome called emptiness syndrome. Emptiness syndrome, once the children grows up, they leave home. You will get a sort of loneliness, sadness, distress. So she has to manage that, all this. And another thing is, it is more for women compared to men. Another thing is, there is a superwoman syndrome in the age group of reproductive thing, in that she wants to be perfect in every aspect of her, whatever career, family, anything you do, and she got exhausted. That leads to a depression or psychological and physiological manifestation. And so many problems. So, during this period, she come across with a lot of physical and mental disorders. So that also, so she has to face all these challenges. So she needs a courage to cope up with the stress. So that's why adoption of yoga in early stage will help us to run this phase smoothly. This is what I just wanted to emphasize on this thing. So one thing is, stress is inevitable in all stages of life, whether it is a children, whether it is a young newborn, or whether it is an adult, adolescent, it is for male or female. But in women also, the stress is inevitable. She needs to face a lot of challenges, but stress is one thing which causes disease. If you see, the mother of all disease, or the thing is, the triggering factor for all the non-communicable disorders, what we speak of, diabetes, hypertension, cancer, anything you take, the triggering factor is the stress. Stress can interrupt the endocrine system, alter the immune functions, alter the nervous function, okay, and which leads to hormonal imbalance, cytokine alteration. What is cytokine? These are signaling molecules that is produced from a cell, from a immune cells. Immune cells, you know, that fight against this, provide immunity, no? These immune cells, and also the neurotransmitters that is secreted from the neurons. These alterations finally land up in disease manifestation. Disease occurs because of this imbalance. Totally, you must know, the imbalance occurs at, the imbalance occurs at all levels. Endocrine, the hormonal imbalance, the neurotransmitter imbalance, the cytokine imbalance. If imbalance occurs, then there occurs disease of all kind. All disorders can happen, psychological, physiological, all disorders can happen. See, this is actually, I'm presenting today the scientific evidence for adopting yoga in women's life. So this is a study. This Indra Yadav Vital, this is the latest study, which says the prevalence of non-communicable disease among women of reproductive age is very high. around 40%, which is something which we need to know. That is so common, and we need to address this. Okay, and the non-communicable disease burden among the reproductive age group women, if you see in India, evidence based from this Singh et al. In 2013. This is basically, they have taken around 50,000 population, and they've surveyed in multi-site, and they found that what are the various non-communicable disease where the woman come across in the reproductive age group. If you see, it is very surprisingly, the first thing is found to be anemia, and where it is only mainly corrected by nutritional aspect. And second thing, if you see, obesity. This is if you see, this is prevalence per 1,000. If you take 1,000 women, around 271 women are having obesity is the main issue. Second thing, what we see is the diabetes, hypertension. This study says, but of course the other study says hypertension. So whatever may be, the most three common things are diabetes, hypertension, then comes the thyroid disease, asthma, heart disease, and cancer, other thing. So this is an evidence-based medicine which says that, so this age group, what is more common is the obesity leading on to diabetes, hypertension, and other disorders. And second thing is, if you see this is a distribution of chronic disease among the reproductive age women. If you see the distribution, and in this 511 women's, 500 out of 1,000 population, they have single morbidity. Single morbidity means they may have single either diabetes or hypertension or obesity or asthma or something like that in the age group of 30 years, median age. And if you take this 257 shows, that is, they have a multi-morbidity. Multi-morbidity means 2 or 3 sets in. 2 or 3 disorders sets in by the time they reach 30 to 35 years, beyond 30 to 35 years. Okay, so this is something which we need to know, and we need to address this. Okay, so this is the National Mental Health Survey, which was done in 2016, which also taken a larger population, and using a tool, what is that, psychiatric tool, to assess the common mental disorders. And if you see, the common mental the disorders are prevalent among women of reproductive age with a significant disability and treatment gap in India. And if you see, the prevalence of common mental disorder among women in the reproductive age group in India was found to be 5.83%. And what is in that also, among the CMDs, anxiety disorder were most common, and the prevalence is around 4.31%, followed by the depressive disorder. And second thing is, nearly 70% of women reported disabilities of varying severity. So this is underexplored. Like, this is what the study which says that around 5% of population is affected, that most of them are having anxiety disorders. Anxiety, okay, and another, or either anxiety or depressed, and they have significant disability. Disability means disability of work life, which affects our work life, which affects our family life, which affects our social life. So one has to think that, and if this is a significant, this study started in 2016, and they published this work in 2020-23 in Indian Journal of Psychiatry, and in 2023, and which shows this a higher range of in Indian population, where and the time, by the time they take the treatment, when full-fledged disease manifest, because they think it is a stigma, and they don't come out of it, that they can able to manage and other things. So what is the solution for this? Okay. And so what then comes the common reproductive health concerns for women of reproductive. What are the other? This is what I showed previously, is the non-communicable disorder, which is very common. Physical. Then we saw about the psychological common mental disorder, where anxiety is more common. Anxiety is a spectrum of disorder where it comes phobia, fear, and post-traumatic stress disorder, many more things it comes. Anxiety followed by depression. Third thing, I'm just talking about the common reproductive health, reproductive disorders. What we see in our community is polycystic ovarian syndrome. which is very, very common. The prevalence is quite high. It is around overall, globally, it is from 5 to 15%, but in India, it is around 10%. And this polycystic ovarian syndrome, many of this thing, it is very seen in adolescents. Then this is polycystic ovarian. That means the ovaries is filled with cyst, the pockets, socks, the sac filled with fluid. Okay. And this is very common, which we come across in our place and other things also when literature say. Then another thing is endometriosis. Endometriosis is with the uterine tissue. The uterine lining tissue is found other than uterus. Normally, uterine lining tissue has to be in the uterus. But if you see this tissue in the ovary or tube, that is the fallopian tubes or any other thing, cervix, vagina, then it is abnormal and she's have severe bleeding and other abnormal things. Then uterine fibroids. Fibroids means growth in the uterus. Then endocrine disorders. Several endocrine disorders will affect the thyroid disorders, pituitary disorders can affect the human. Another thing is pelvic inflammatory disorders, that is inflammatory pelvic infections, lower genital infections, sexual violence, abuse, gynecological malignancy, and menopausal. I have highlighted the two things in red. That is, I'm going to emphasize, talk little more about these two things, which is more common in our place. So remember this. So these are the common disorders which commonly women come to us for treatment. Okay. And what is more common? PCOS. PCOS is the most common condition, common hormonal disorder in females of reproductive age. It is characterized by two or other features. Okay. Like irregular menstrual cycle, hyperandrogenism. What do you mean by hyperandrogenism? That means the testosterone level, androgen level will be more, and cystic ovaries. And this is the prevalence of PCOS in Indian women is found to be close to 10% based on a criteria. This is, we use this criteria to identify PCOS in adult. Most of the adolescents is shown to have. If you see in India, that is around every 5 women, if you screen, around 1 is found to be this disorder. Whether they are but full-fledged disease they might not be having, but they are at risk for developing polycystic ovarian disease. Okay, so this Rotterdam criteria, basically just forget it. Using 3 things we will find out. One is the anovulation. That means whether your menstrual cycle is ovulatory cycle or non-ovulatory cycle. That is one thing. Second thing is that whether the androgen level, the free testosterone level will be very, very high. And third thing is ultrasound. If you do, this ovary is big, bulky ovary with multiple follicles, more than 20 follicles. If you see, then it is diagnostic of polycystic ovarian disease. Okay. If any woman with the obesity, with this thing, with menstrual irregularity, one should go for screening for polycystic ovarian disease. Okay. PCOS. Why PCOS is important? Because it is not simple. It is associated with multimorbidity. In the sense, it is associated with infertility, diabetes, insulin resistance causing diabetes, pre-diabetes, cardiovascular disease, obstructive sleep apnea syndrome, cancer, and non-alcoholic liver disease, fatty liver disease. So one need to find out, survey and screen for PCOD, and you have to treat. And another thing is, what is shown is yoga-based life intervention. Yoga-based intervention have been proven to reduce and manage the symptoms of PCOS more effectively along with medication. First line of therapy for these people is only the lifestyle management, where they found that yoga-based intervention is found to be very effective. And this is what this thing says. How this PCOS? PCOS, we can, physical science itself will say PCOS. One is obese. The women will be disproportionate obesity, central obesity. That means in the abdominal obesity. Acne, that is acne in the face. Hirsutism. Hirsutism means abnormal hair growth in the face, which is not normal. If somebody is having excessive hair growth in the facial aspect, trunk, or in the back, then which also shows. Then acanthosis, like recurrence, they will say hyperpigmentation in the skin fold, in the neck side, axillary area, and other skin folds. And another thing is it is also associated with irregular periods and increased risk for developing the cardiovascular disease. Then once you have these symptoms, and if you are obese, you have to suspect for whether the female is having a PCOS and go for confirmation. And if confirmed, the first line of treatment is about the lifestyle modification in which yoga has a holistic approach in managing these symptoms, which has already been proven by few studies. And she will also show what are the yogas which is beneficial for this condition. Okay, we'll come to it later. So, so this is one thing. Then what is how yoga address PCOS? Yoga, basically, all of you know, it is a mind-body intervention and has been reported to improve the symptoms and signs associated with PCOD. And also prevent the complications of PCOS by psychoneuroendocrine immune mechanism. What do you mean by that? By interaction with the neural, endocrine, and the psychological aspect. By interacting with this thing, it tries to, by activating these pathways, it tries to correct the symptoms associated with PCOS. There is improved social well-being, reduced stress, which indirectly improves the PCOS. It was already been shown. Then another thing unique about female is postpartum pelvic floor rehabilitation. What is this postpartum? Postpartum period is immediately after delivery. What is very common? That is also yoga shown to be proven. Postpartum pelvic, this thing is during pregnancy and childbirth, the pelvic floor muscles and fascia are excessively stretched. This is because of another important factor which get excessively stretches because of using of instruments during the delivery. All of you know that they use either the suction or the what is that? That is forceps. Okay, to deliver the baby once it has come to the lower uterine segment. They don't go for C-section. Once the baby descends down, then they put either a forceps or they put a vacuum to pull the baby out and this thing if the mother is not putting more effort. So in this condition, there is a varying degree of damage in the pelvic floor muscles and pelvic muscle fibers and fascias. So that result in impaired pelvic floor function, potentially triggering problems like pelvic organ prolapse. That means the vaginal prolapse, uterine prolapse. Uterus will come out through the orifice, vaginal opening. And another thing is incontinence. That is, they're not able to control the urinary incontinence, urinary flow. And diastasis recti. That means in the abdomen, you have, in the abdominal wall, you have a rectus abdominis. There is a partial or complete separation of the rectus abdominis is called as diastasis recti. These are very common after delivery, and many of them don't give importance for these things. And if it is not given, these problems affect. A number of studies have shown that adherence of postpartum rehabilitation exercises can effectively restore the pelvic floor muscle strength and pelvic floor prevent the pelvic floor disorders and functions. Okay, so these are this is the pelvic. If you see this pelvis with a lot of muscles, some of you must be knowing about what are the muscles which regulate the pelvic floor. That is the levator ani, pubococcygeus, iliococcygeus, and puborectalis. These are some of the muscle which keeps the patency, strength, tone of the pelvic muscles, and this get laxed when she delivers. So pelvic floor rehabilitation is very important, and yoga is found to be beneficial in this thing. The practice of yoga and hypopressive exercise during postpartum period is effective approach in pelvic floor rehabilitation, which was also few studies have demonstrated. Many studies are not there in this aspect. So one is hypopressive yoga. All of you know the asanas, mainly the asanas, the pranayama, and also the meditation, and then the bandhas, the locks. You must have heard about the various locks, no? The abdominal lock, the Uddiyana bandha, the Moola bandha, the throat lock. Okay, what is Jalandhar bandha? I'm a little poor in this pronunciation, but I remember that the throat lock, abdominal through this abdominal dog. So this is something like that you need to do. This hypopressive exercise is very beneficial. It is something similar to yoga in the sense that what you have to do is you have to just it is like breathing with a particular posture. Breathing means breathing. It is like holding the breath after exhalation, so that you can reduce the pressure in the abdomen, release the pressure, make the muscle contract to tone up the muscles of lower pelvic organ. And that was very efficient in this thing, in doing it in a sequential order in a specific postures. Okay. So that is what is one thing which is shown here. Okay. Another thing, what is very common is the premenstrual syndrome. This also you would have heard. It is also very common and unique to all the women and the younger age group. Premenstrual syndrome is a common disorder affecting women of reproductive age with a global estimate of 47.8%, with severe symptoms occurring in 3 to 8%, which affects totally her life, quality of her life, which leads to a substantial distress and significantly affecting the day-to-day function of the women. And symptoms of PMS includes change in the appetite, craving for certain things, weight gain, sudden weight gain in the luteal phase, second half, just prior to menstruation, abdominal pain, low backache, headache, swelling, tenderness, heaviness of the breast, nausea, constipation, anxiety, irritability, anger, fatigue, restlessness, and mood swings. These are the common symptoms where women come across. But if it is very less, usually it is manageable. But if it is very severe, and if it affects our quality of life, day-to-day life, then it needs to be addressed. And studies have, the mentioned discomfort, that is both physical and psychological, is associated with luteal phase of the menstruation. You know the menstrual cycle as a proliferative and the luteal phase. In the second half of the phase, just prior to menstruation, these symptoms are very common and typically resolve with the occurrence of the menstruation. So these several things are put forth for this. But we'll not go into this thing. This is more of what you have to know is the hormonal fluctuation is the factors which is attributed to the development of PMS. Then increased level of inflammatory parameters, neuropeptide malfunctions, neurotransmitter disturbances are all attributed to this thing. So now our thing is, and PMS, yoga has found to be a very positive effect on reducing both the physical and psychological symptoms of PMS, evidenced by several studies. I have put two, recent studies, which brings about the hormonal regulation, stress relief, neuropeptide regulation, all these things. So it has been proven to be an effective. So third thing, what I want to emphasize in women's life is the non-reproductive, the climacteric age, 5 years prior to menopause. And 5 years after menopause is climacteric age, and what are the problems she faces. The climacteric age is defined as a period of transition from woman reproductive to non-reproductive life, and extends from 40 to 65 years of age, and it is a transition to menopause and post-menopause. And if you see, this phase is vulnerable period for the onset of vaginal atrophy. That means there is atrophy of the vagina, urinary symptoms, heart flushing symptoms, urinary symptoms, sexual dysfunction, and there is an increased risk for cardiovascular disease, osteoporosis, thinning of the bone, psychological manifestations such as irritability, nervousness, depression, sleeplessness, fatigue, and anxiety. Also, the perimenopause is accompanied by other physiological changes like vasomotor symptoms, metabolic decline. There is decline in the psychological functions. So evidence-based medicine says that the reproductive hormonal milieu of menopausal transmission precipitate to these symptoms. These bothersome symptoms are because of the alteration in the reproductive hormonal change, hormonal fluctuations, which causes mood disruption, brain function, decrease in the brain function, genitourinary symptoms, and other process which reduce the quality of woman. Okay, so yoga is found to be fairly effective in managing these menopausal symptoms and improves the quality of life in women's life. Okay, so, and now we come to so this is basically, I just wanted to emphasize that what are the common problem women, any woman which come across during her lifespan. Okay, that is one is very common. What we come across is disorder is the PCOD. What is seen as the PMS and the climacteric phase, the menopausal transition. So all of you know yoga is a mind-body intervention That means, and previously it is basically a science and art of healthy living. Previously, the traditional practice of yoga was primarily concerned with the personal enlightenment, but now the focus has been shifted toward health promotion and disease prevention, because a number of scientific research has documented this, the benefits. Although there are many schools of yoga, which schools to follow? So Bhakti, Hatha Yoga, Jnana Yoga, Karma Yoga, Laya Yoga, Mantra Yoga, Tantra, many more schools. But what scientific data is available only for two things. One is the Hatha Yoga, and another is the Raj Yoga. Hatha Yoga focuses on physical fitness, which is achieved by postures and purifying techniques. By perfecting the body, the practitioner achieve the better health. Raja Yoga focuses on control of mind, which is achieved by 8 steps, that is called as the Ashtanga Yoga, okay, which was already was discussed. This Ashtanga Yoga has Yama, Niyam, Asana, Pranayama, Pratyahara, Dharana, and Dhyan and Samadhi. So by these are, but what is available? What literature, what is scientific data is available for only for asanas, the pranayama, and the meditation. Rest of the thing needs to be explored. For the scientific aspect, the scientific research should be done on these aspects. Patanjali is the father of yoga, who has refined this aspect, and scientific compiled and given as a Yoga Sutra, which is used, which this Ashtanga Yoga is done for all round wellness. So then we'll come to the yoga for women. If you see this Muraj Desai, MDNY, has given the what are the yoga recommended for women in reproductive age group, that that we will be seeing a demonstration shortly. So, but I have taken only one aspects because I've gone through the literatures, I mean the scientific research, and they have found that for PCOS, because I've emphasized on PCOS. PCOS especially has one thing is that you need to address their symptoms and the other risk factors. So what is very effective is that first thing is, if it is severe, first thing is medication. It is not a soul this thing. If it is that depends upon again the criteria. If it is an early thing, only lifestyle. Second thing is, if it is severe, and if there is a criteria to diagnose the severity, and if it is severe, then always medication along with yoga as a adjunct therapy. In that yoga, what is beneficial is the asanas, Surya Namaskar, fast Surya Namaskar. So that will help in decreasing energy expenditure and decreasing the obesity part will take care. And other thing is, these are the asanas which is found to be beneficial. Many of the scientific articles shows these asanas and pranayamas, that is Malasana, Badagonasana, Sedubandhasana, Dhanurasana, Bhujangasana, Marjariasana, Janusirasasana. These are very effective in patients having the PCOD problem. And coming to the breathing part, the pranayama part, mainly the Kapalabhati. Okay, Kapalabhati pranayama, then the sectional breathing, the clavicular, the thoracic, and the abdominal breathing. The sectional breathing is very beneficial. And second thing is the Analom Vilom, alternate nostril breathing. And third thing is the Brahmari breathing and the Savasana. These are very effective in managing the PCOD, which is one of the commonest problem we encounter in adults, adolescents, adult period, and in young. So there are a lot of benefits for yoga. All of this you people will be knowing, but it is not only for females, it is for all. That is, it builds strength, maintain bone health, healthy weight gain, good sleep, improved sense of balance, increase blood flow, neuroprotection, boost immunity, improves lung capacity, and promote cardiovascular health. This is in general if you practice yoga. This is all these things, if you Google it and if you go to the scientific website, all has scientific evidence, all has been proven. Second thing is, what are the proposed mechanism by which yoga improves the health? One is hormonal regulation. It controls, because the key point which affects the reproductive age group is hormonal disturbance, fluctuation. Cortisol, catecholamine reduction associated with reduced stress and anxiety, neurotransmitter balance, parasympathetic activation, especially when you do the pranayama, the slow pranayamas, there is vagal nerve stimulation, which causes relaxative response, and mindfulness meditation, which is found to improve the structural changes in the brain. So particularly in the regions associated with stress response and emotion. So there is an emotional control, self-awareness happens, and there is reduction in the inflammatory markers. Then there is improves cardiac health. Okay, that is regulation of the blood pressure and this thing. Then the thing is there is enhanced resilience. The person will be more adaptable to life challenge and better equipped to cope up with stress. There is a improvement in the sleep. Then there is increase in the heart rate variability. That is variation in the heart rate. There is this is called as heart rate variability, which is an indicator of resilience of stress, resilience to stress. Okay, marker of resilience to stress. Another thing is there is psychological apart from there is also psychological improvements in all the anxiety, stress reduction, all this thing. It fosters the positive emotions and counteract the negative. Another very important aspect, what we saw is the telomere length and enhancing telomerase activity. I hope you know what is telomere. You see the chromosome, the telomere is one thing which is like a cap. That size matters. If the size shortens, then your biological age will be it is an indicator of the biomarker of aging. If it see in disease process, and if you have adopt unhealthy habits, this size decrease. If the size is more and the telomerase enzymes is more, then you have a prolonged life. Okay, so that has already been documented. So to conclude, yoga offers a wide range of benefit for women health. It is a cost-effective method with multifaceted health benefits, and regular yoga practice has proven to bring about hormonal balance, enhanced fertility, well-being during pregnancy, postpartum, good postpartum recovery, alleviate the symptoms associated with menopausal transition, and therefore it brings about the holistic health and wellness for women. Okay. Oh my God. I'm really surprised. So only during this thing, the current is coming. People will be sweating. So I don't know how to take it, how to interpret it. Then maybe you have to interpret. Good. Now she's going to give a demonstration on this. Probably that is why the light has come. So in nutshell, so with the we are all eagerly waiting for International Yoga Day. And this year the theme is Yoga for Women Empowerment. So I have just focused on what are the health issues specifically for women of reproductive age group and how yoga helps in counteracting this. So with this basic introduction, let me ask my yoga instructor. We have an in JIPMER. I'm working in JIPMER, as already it was introduced. We have an yoga center where our yoga instructor, Mrs. Vidyalakshmi, will be giving a small demonstration on specifically the asanas which is recommended for reproductive age group. Okay. Thank you. I'll go there. So now she will show about the certain things, that is the Surya Namaskar, just one or two rounds of Surya Namaskar, then few other this asanas and few pranayamas which a woman has to practice in reproductive age group, which is found to be beneficial. And I've already documented what are the things. Okay, now you can start with Surya Namaskar. The loosening practice. Always when you do this thing, you all know that you have to just loosen all the joints and other things. So few minutes of loosening practice followed by Surya Namaskar and then Samasana. So she's showing about the loosening practices, that is in the neck. See, all these things have to do with breath coordination. So that is how yoga is different from other things. Right to left, up and down, all this loosening practices then. Trunk movements. Slowly and with breath coordination. See, these are easy things which anyone can do. It's not. Knee movements. Up and down. Then followed by, which we'll start with asanas. Standing asanas. Oh, for Surya Namaskar, you just show. Okay. So the 12 rounds of Surya Namaskar she will be showing. All of you are familiar. Just you have a very nice yoga center where it will be taught, but just she will demonstrate to you all the 12 steps. She is experienced, so she's doing it. For the beginners, you can do it at your capacity and then slowly you can achieve this. Standing asanas. So she'll demonstrate 3 asanas. One is Tadasana. Then you can show Ardha Katti Chakrasana. See, these has to be all these asanas, all of you know it should be done slowly with breath coordination and you have to maintain in that pose to get a full benefit. And always you have to do it whenever you do these things, always a counter pose. No, not you have to do it in one side and should not leave. Should do it on both sides. Tiri- Tirikonasana. These exercise will tone up your abdominal muscles, your spinal muscles, strengthen these. Other side. Can go to slowly sit and then show it in sitting asanas. Makarasana. Left side. Counter pose. Padakonasana. Butterfly pose. Okay. Okay. With Chin Mudra she's doing. Okay. All these things will improve the vascularity in the pelvic region and also strengthen and tone up the pelvic muscles. Next, Marjorie Asana. One has to hold the pose with breath coordination. Yes. Then come to prone asanas. Bhujangasana. Ardha Shalabhasana. Now she is relaxing in Makarasana. Now you show Ardha Shalabhasana. Slowly come to supine pose. Relax. Now Setu Bandhasana. Come to supine pose. Pavana Muktasana. Slowly come to sitting pose. So these are the asanas which MDNY recommends for reproductive age group women to regularly practice to inculcate in their life. Now with this thing, we'll come to the pranayamas, that is the breathing, breath control techniques. What is commonly advocated for PCOS is the studies are there for Kapalbhati pranayama and sectional breathing. You will show first Kapalbhati, which is also called as a fast breathing. Some sit straight, eyes closed, spine straight, chin mudra. Deep inhalation and forceful exhalation for 10 to 20 counts for the beginners. Deep inhalation and forceful exhalation, which is performing. Second thing, what is recommended is the sectional breathing. Just relax. Sectional breathing includes 3 parts. That is the clavicular breathing. You focus your attention on the clavicle, the clavicular part of your thorax. Focus your attention, take a deep inhalation and exhalation slowly. Always we do it for 6 rounds because of time constraint. I'm restricting, I'm just showing it. All these things are feasible. Next, we'll go into the thoracic breathing. Focus your attention on the thorax. Deep inhalation followed by exhalation. When you inhale, count it. When in this four to 6 counts, and exhalation also equal. We don't use breath holding during this. Then comes the abdominal breathing. All these things increase your oxygenation, cellular oxygenation, and the vital capacity will also be more. It has many more benefits. Okay, sit straight. Now you can do alternate nostril breathing, Nadi Shodhana Pranayama. That is, close the right nostril, inhale with left. Alternate nostril you have to use with concentrate your attention. You have to concentrate your attention on the breath. Close one nostril, take inhalation. And when you inhale, you count for 4 breaths and then exhale through the other nostril. And similarly, inhale through the same nostril and exhale through the other nostril. That is alternate nostril breathing. All these things, you kindly don't do it by yourself. You go and learn it from an yoga instructors and this thing and try to practice it. This mudra, what she shows is the Nasaga mudra. Can do it. It is easy. Now we'll go on to the next thing. That is the Brahmari Pranayama. This is Shanmugi mudra. Mudras is known to improve the pranic flow in the nadis. So inhale and exhale with a sound, with a female V sound. That's why it is so known as Brahmari Pranayama. One more time. Inhale and exhale with a sound of a female bee. This vibration has a tranquilizing effect on the brain. It calms down the effect, these vibrations. So these are some of the, pranayamas recommended for this thing. Of course, I have shown you the booklet. It is freely downloadable. You can download and see what are the pranayamas or what are the yoga recommended for different age group, reproductive age group, climatic age, everything is there in that. You can just practice those things, but try to learn it from a good center, from a yoga, experienced yoga instructor, and then you don't do it on your own. Don't try to do, because it has its own side effect also. Just like that, people cannot do on seeing the video or on seeing the various videos or these things. Okay. So, and this is followed by the relaxation, which we are not doing here, and in Savashan. So with this, these are the simple techniques which you adopt in your life at the early life, at early onset, early career itself, in your early part of your life. Then it will have a massive impact on your well-being, woman well-being, and it gives a holistic health for the females. That's what I mean. Thank you, Vidyalakshmi, for this, your excellent demonstration. If you have any queries, you can ask, or if time permits or other this thing also, I'm ready to answer. Any questions anybody would like to ask? I can have few questions if anybody is having. Actually. Actually, we have a Advanced Center for Yoga Therapy Education and Research. Sir has actually started this along with Dr. Professor Balayogi sir, along with actually with Madan Mohan sir, along with the team, the team, and sir is the prime person there. And that center is still continuing. And we are catering for the JIPMER patients and JIPMER family. In the sense, the staff, students, and the faculty members of this thing. That is their restricted group, but it has widely extended here in this thing. I'm happy to see the work, what you are doing. Thank you.
Thank you, ma'am, for talking about such practical issues that women are facing every day. I invite our director, sir, Professor Ananda Balayogi Bhavnani, sir, to honor our resource person. Inviting Mrs. Vidyalakshmi.